The U.S. healthcare delivery system lacked coordination across health professions. In response, the Interprofessional Educational Collaborative, known as IPEC, formalized a set of competencies needed by healthcare professionals. As you can see in this slide, the vast majority of healthcare professional organizations are members of IPEC, thus ensuring an educational commitment among their constituents to deliver interprofessional collaboration and team-based care. The major concepts reflected in the IPEC competencies include a behavioral approach that is about a collective way of being in the health world, a dynamic use of self that is attitudinal, and the belief that interprofessional collaboration multiplies the advantages and divides the challenges faced in providing quality health care. The IPEC competencies, designed in 2013 and updated in 2016, are broken down into 4 domains that each contain sub-competencies. Values and ethics refers to work with individuals of other professions to maintain a climate of mutual respect and shared values. Roles and responsibilities is to communicate one's roles and responsibilities clearly to patients, families, community members, and other professionals. Interprofessional communication signifies that professionals communicate with patients, families, communities, and professionals in health and other fields in a responsive and responsible manner that supports a team approach to the promotion and maintenance of health and the prevention and treatment of disease. Teams and teamwork apply to what it means to be relationship building and the values and principles of team dynamics that allow one to perform effectively in different team roles to plan, deliver, and evaluate patient and population-centered care and population health programs and policies that are safe, timely, efficient, effective, and equitable. This slide outlines each of the sub-competencies of the values and ethics domain. Here are the sub-competencies of the roles and responsibilities domain. This slide outlines the sub-competencies of the interprofessional communication domain. And the sub-competencies of the teams and teamwork domain. As this module discusses the interprofessional intersection of social work and nursing competencies, we will identify each discipline's standards. Here, the Council on Social Work Education has identified 9 competencies expected of professional social workers. These competencies cover values and ethics, social work's commitment to upholding diversity, advancing social justice, engaging in research and policy practice, and engaging, assessing, intervening, and evaluating social work practice across a variety of populations and settings. For the purposes of this module, we will apply social work competencies 6, 7, and 8. Competency 6 ensures that social workers have the ability to apply knowledge of human behavior in the social environment, person and environment, and other multidisciplinary theoretical frameworks to engage with clients and constituencies. Competency 7 builds on engagement skills while also analyzing assessment data from clients and constituents. The 8th social work competency focuses on interventions with individuals, families, groups, organizations, and communities while building on the previously mentioned engagement and assessment competencies. Competency 8 notes the ability to critically choose and implement interventions, negotiation and advocacy on behalf of clients to advance mutually agreed upon goals, and utilizing multidisciplinary frameworks and interventions. This competency directly identifies the ability to use interprofessional collaboration as appropriate to achieve beneficial practice outcomes. In addition to the roles and tasks outlined in this slide, social workers work with a variety of populations within numerous settings. To name a few, social workers could work with children and families, adolescents, adults, and elders. Social workers are found in hospitals, nursing homes, behavioral health clinics, schools, correctional facilities, and addiction treatment centers. The discipline of nursing is based on science combined with the art of caring for the individual needs of the patient. Bringing a holistic perspective of the patient, nurses engage in advocacy, building rapport across healthcare professionals and with families. The role of the nurse is to function proactively, utilizing their knowledge to prevent complications and improve patient outcomes. Nursing outlines their standards through 7 essentials of nursing covering science background, organizational and systems leadership, quality improvement and safety, integrating scholarship into practice, healthcare technologies, and health policy and advocacy. Essential 7 directly addresses interprofessional collaboration to improve patient and population health outcomes. For the purposes of this module, we will be applying the interprofessional essential. Here we see the intersection of social work and nursing's interprofessional practices. Each of the disciplines specify interprofessional communication, collaborative practices, patient-centered care, evidence-based practice, maintaining ethical standards, promoting health equity, patient safety, and team-based care.